Hello, I'm Dr. Richard Lukandwa. I'm the Acting Medical Director at Medipal International Hospital. I'm going to talk to you very briefly about high blood pressure or hypertension. Sorry, I'll remove the mask. It's a COVID pandemic because at least I'm 2 meters away, and it'll be more clearer if I speak without the mask. So what is hypertension? Hypertension is when the force on the walls of the blood vessels is higher than normal, which causes patients to be at risk of serious conditions like heart disease and stroke and other problems. How do we know that we have high blood pressure? You do it by measuring at the doctors. And when you do measure at the doctors, they put a machine on your arm, usually called the blood pressure machine, and they put a cuff around your arm, and you get two readings. You get the top reading, which is called the systolic blood pressure, and you get a bottom reading, which is called the diastolic blood pressure. When the doctor looks at both readings, if either of them is high persistently, usually after a few visits to the doctors, then we call that high blood pressure. What are the methods of diagnosis? One-off readings from the doctor, but you need to take several readings for several days. You may use home readings, which are more accurate, because we find that when people go into hospitals, they may get what they call white coat hypertension. Because of the anxiety of going into the hospitals, the blood pressures may be high. Another, which is almost the gold standard of diagnosing high blood pressure, is what we call ambulatory blood pressure monitoring. You go to the doctors, they put a tool around your arm, and it measures the blood pressure over a period of time, usually 24 hours. That gives us an accurate assessment of your blood pressure throughout the day and is a useful diagnostic tool. What do we do? In Uganda, the prevalence or the presence of hypertension is about 1 in 4, which is quite a very high number, which may partly explain why there's an increased risk of strokes in the Ugandan population. There's a lot of stress, also it may be related to salt intake. We're also becoming a society that's growing big in size, or obesity, then a sedentary lifestyle. All those contribute towards the risk factors for hypertension. Then kidney disease, etc. What do we do if someone has hypertension? We have, if it's not severe hypertension, because there are different grades. There's grade 1 and grade 2. If there's grade 1 hypertension without any other risk factors for heart disease, we can use lifestyle to try and control the blood pressure. And what are lifestyle measures? One, if a person is a high body mass index or they are overweight, you do weight loss, which is either through exercise or nutrition. So weight loss is number 1. Number 2, reduction in the salt intake. Number 3 is increasing your physical activity or exercise. We recommend exercise about 30 minutes a day, 5 days a week. And exercise is something where you sweat and your heart rate increases. It ranges from brisk walking to running to skipping on a rope, going into the gym, etc. If you don't get your target blood pressure with lifestyle, then the next option would be to use drugs. And there are a number of drugs that are available for blood pressure, and the doctor will prescribe you the drugs. If you don't get success with one drug, you may end up having to use multiple drugs, and there are quite a number of drugs available in the market. So why do we have to treat you with high blood pressure? It's because most of the time, if we don't treat you, you may get the problems or the complications of high blood pressure, which involves stroke, heart attack, kidney damage, etc. Thank you very much.